Hi there, this is Zoe. In the next 5 minutes, I'm going to walk you through how to conduct a simulated virtual visit using the Virtual Visit Sim app. This learning activity is a simulation of a virtual chat visit between a healthcare provider and a patient, or a parent in the case of a pediatric patient. Each case will take you between 10 to 20 minutes to complete, depending on your level of expertise. There is one sample case for you to practice with at the start of the activity as an example of how to interact with the chat message format. The simulation space is separated into three panels: patient information, chat, and diagnosis and treatment. Patient information, including name, chief complaint, age, gender, weight, allergies, medications, past medical history, and immunization status, will be provided in the upper left panel. In the upper right panel is the chat with the patient or caregiver. The diagnosis and treatment panel will be locked until you have completed the chat. Once you click Continue, the chat feature will be disabled. You will want to make sure you ask all necessary questions before you make your diagnosis. For each case, there are 6 to 8 pertinent questions related to the chief complaint that are important to ask prior to choosing the final diagnosis and management plan. You can reference these sample questions from the Encounters page. If the question is not pertinent to the diagnosis, a message such as "I'm not sure" or "I don't understand" is displayed. If appropriate for the case, you can ask the patient or caregiver to send you an image. This might be an image of a prescription bottle to verify the medication and dose, or an image of a rash or wound. The first pediatric case is a sample case that you can practice on. Let's walk through this together. Click Start to begin. This is an 8-month-old male named Noah Oliver. He has a chief complaint of a rash. His medications, past medical history, and immunization status are listed for you to review. The caregiver's message says, "My son just broke out in a rash. It started this morning after I gave him his famotidine. I put some diphenhydramine lotion on the rash, but it hasn't helped." Begin the simulation by texting an appropriate question related to the chief complaint. You will receive an automated response to the question. As a healthcare provider, you might be concerned about an allergic reaction. Try asking about any swelling, itching, coughing, or noisy breathing. The caregiver responds, "No, he's acting fine. The rash doesn't seem to bother him, but the rash looks horrible. It's all over his body." Try asking if he has a history of sensitive skin. The caregiver answers, "No, he has never had anything like this before." Perhaps he was exposed to someone else with a rash. Try asking if he had been around anyone with a rash. The caregiver reports, "No, he hasn't been around anyone with a rash." You might decide to ask about any history of recent illness. The caregiver reports that there have been a lot of kids at daycare with fever and runny nose, but Oliver never had a runny nose. Try asking about other symptoms like diarrhea or vomiting. The caregiver reports no vomiting or diarrhea. Try another one. The caregiver mentioned exposure to a fever before. Is the patient having a fever? The caregiver gives us an interesting clue to the diagnosis. He had a fever of 102 for 2 to 3 days earlier in the week, but he never had any other symptoms. He's not acting sick now. He's playful and eating and drinking normally. As a provider, you have a pretty good idea about the diagnosis based on the history and symptoms. But to confirm the diagnosis, you should ask if they could send a picture of the rash. The caregiver responds, "Okay, I will send it now." You receive the photo, which is consistent with a viral exanthem. Now that you have asked the pertinent questions to determine the diagnosis, you can move on to complete the diagnosis and treatment section. Remember that after selecting Continue, the chat will be disabled. Now it is time to make your diagnosis. Choose from one of the options listed. In this case, you should choose roseola. Click Continue. Then, choose one of the treatment options. For this case, no treatment is necessary for this rash. Click Continue. Next is the treatment recommendations. This is where you will want to give the patient or caregiver a brief explanation of the diagnosis, special instructions, warning signs, and when to follow up. Keep it as brief as possible, but include key recommendations. For this case, you might text something like this. Click Submit Treatment Recommendations. There you will see the correct answers to the case. Click Continue. Congratulations! You have finished your first case. Click Finish to return to the home screen and complete more scenarios. After you have worked through all of the assigned cases, complete the post-simulation debriefing and survey as instructed by your professor. We hope you have found this tutorial helpful and that you will enjoy using the vVisit Sim app. It is our goal to increase your knowledge and confidence in this evolving form of healthcare delivery. Now it's time to begin. Choose your first case and get started.